Repair of Entropion, suture. An entropion is an inversion of the margin of the eyelid. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. The physician threads sutures through the inferior fornix or inferior cul-de-sac externally to the lash line. The sutures are placed in the medial, middle, and lateral third of the eyelid in a mattress fashion. These absorbable sutures are tied on the skin side. The sutures act to avert the eyelid margin anteriorly, correcting the malposition of the eyelid. Repair of Entropion, thermocauterization. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. The physician uses bipolar or monopolar cautery to create a central tissue shrinkage to rotate the eyelid margin anteriorly. This corrects the malposition of the eyelid. No incisions are made in this procedure. Repair of Entropion, excision tarsal wedge. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. A triangular section of tarsus is excised from the eyelid. A large Calazian clamp may be used to avert the lid and excise the triangle of tarsus, which usually measures 8 mm to 10 mm at the base. A piece of exposed orbicularis muscle is removed with the wedge. The edges of the excision site are approximated and repaired with sutures. Repair of Entropion, extensive, e.g., tarsal strip or capsulopalpebral fascia repairs operation. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. The physician makes the incision along approximately 80% of the width of the eyelid for extensive repair. The physician uses deep sutures to sever the eyelid margin outwardly. Strips of tarsus may also be excised from the eyelid. All incisions are repaired with sutures. Repair of iris, ciliary body, as for iridodialysis. After placing an ocular speculum in the patient's eye, the physician makes an incision at the juncture of the cornea and sclera, the limbus, to approach and repair a trauma-caused tear of the iris from the ciliary body. The wedge-shaped tear is affixed to the ciliary body with dissolving sutures, or with stitches that can be removed through an incision prepared for that retrieval. This procedure includes the later removal of the mecanal suture. The physician may close the incision with sutures and may restore the intraocular pressure with an injection of water or saline. A topical antibiotic or pressure patch may be applied. Tympanic membrane repair, with or without site preparation or perforation for closure, with or without patch. Under microscopic visualization, the tympanic membrane is repaired. The physician may roughen the tympanic membrane perforation, rimming the perforation, to prepare the site before closure and may apply a paper patch. In some cases, the edges of a traumatic perforation of the eardrum may need to be elevated from the middle ear with a delicate hook.